Hi friends, today let's see the modifications of the papilla preservation flap. In the last video I have explained in detail about papilla preservation flap. In that I have discussed that the two disadvantages of the papilla preservation flap, that because of the extended flap and the long incision we don't do that recent now. So we have given the modifications. One is the modified papilla preservation technique and other is the simplified papilla preservation technique. So the modified papilla preservation technique would be used in the wide interproximal area, anteriors up to premolar. Here in this cast I am showing in the posterior area, but actually this has to do in the wide interproximal area and up to above or equal to 2 mm. Whereas in the simplified papilla preservation technique, we do that in the narrow interproximal area, especially in the posteriors. So maybe less than 2 mm. So we'll see how the incision goes in the MPPT, that is modified papilla preservation technique. In that, first we have to give, in the buccal aspect, we need to give the two intercircular incision, and then we have to perform on the palatal aspect, and these connected by a single horizontal incision. And then these horizontal incision are straight and non-continuous at the base of the papilla. So let's see how it goes. First we have to give two intercircular incision. See, we have to give two intercircular incision. See, intercircular incision, and then palate also we have given that intercircular incision. Okay, we have given intercircular incision, buccal and palatal, and here, and these connected by a single horizontal straight non-continuous incision. So this we have to give the horizontal incision. So now we have given the two circular incision and also the horizontal incision, and then this papilla is there, no? So now this is detached, and this papilla is involved in the palatal flap, not in the buccal flap. Actually in the normal papilla preservation flap, we have seen that we move this papilla buccally. Here it goes into the palatal flap, palatal area, and then we have to reflect the full thickness flap only to expose the crest of the alveolar bone. No unnecessary bone exposure post-operatively. If that means post-operative bone loss can happen, and after this we can do the debridement, grafting or etc., whatever indicated in the case. And if the vertical incision are required, example to attain the primary closure of the interproximal tissue, sometimes we need to give the vertical incision and coronal placement of the flap, and then if that is required means we can give that. And after that we have to do the suturing, and here we need to give the multiple type of suture, like the sling suture, horizontal internal mattress suture, vertical internal mattress suture and interrupted suture. These all multiple types of suture can be given after this procedure. And whereas in the simplified papilla preservation technique, we are going to give first the horizontal incision, little oblique. That means here means it has to, the space has to be little, it should not be this much of wide. In the narrow interproximal area we give this kind of simplified papilla preservation technique. Here we have going to give one horizontal incision which is oblique, so it has to give like this, little oblique, and then oblique and go circular, intercircular incision like this. So if you see the cast, you understand. So first we have given the oblique incision, and then it has to go upwards vertically and give the circular incision. See, and then this portion has to go palatally. See, this is how the incision goes, and then from where it has to, then this incision has to start from here. See, from here till here. See, we have given incision like this, and after that labial flap reflected as the full thickness flap, but don't use the mucoperiosteal elevator. We are doing mucoperiosteal reflection, but don't use the mucoperiosteal elevator because we don't want to cause the unnecessary trauma to the tiny tissues. And this, in the palatal aspect also, we can give the full thickness intercircular incision and no horizontal incision to connect. And then we can give the debridement and grafting, and then we can do the suturing. And then we can do the approaches to ensure the primary closure are the routine flap approximation, extend flap mesiodistally, periosteal incision, vertical incision. These all approaches we can do to ensure the primary closure, and after that we can do the suturing. So this is the simplified papilla preservation technique, and this is the modified papilla preservation. And then this thing all the more MPPT also we can do in the narrow interdental region, but more result has come from this SPPT. So that's why we are doing SPPT. These two are the modifications of the papilla preservation flap. I think you are clear with these three, and thank you.